11 million North Carolinians. All 11 million of us. So each person represents 110,000 North Carolinians. 1 through 100. Okay, now this bill, the one big ugly bill, is really an extension of Trump's tax cuts from his first term. There really are no new tax cuts in this bill. This bill is about making permanent the tax cuts for the most wealthy. I'm going to show you the ramifications that's going to have. Because what they tried to do is they tried to balance this bill by removing services to all the rest of us. And we're going to show you what those references look like. So let's talk about that. Medicaid and health care cuts. As you probably know, you've heard this many times, 1 in 4 people in North Carolina are on Medicaid. That's 25%. Okay? North Carolina finally expanded Medicaid in 2023 to allow people to get on Obamacare. 2023, 2 years ago. But they put some triggers in that bill. If federal support stops or administrative costs go too high, they can cancel that. That expansion will end. They also, in this bill, put stricter eligibility and Medicaid requirements for adults. And one of the big things you're going to hear about is you have to be reckoned to be on Medicaid. Well, it turns out today, before this bill, 2% were the only number that were not working, and they were looking for work. So that's a fallacy. Medicaid recipients are working if they're able to work. Right? An estimated 670,000 people in North Carolina are going to lose health insurance. People 1 to 6, sit down, you're dead. Since 2010, North Carolina has lost 8 rural hospitals, the 3rd highest in the country. North Carolina helps fund Medicaid through a thing called the provider tax. This bill caps that tax. And it's estimated North Carolina is going to lose $500 to $900 million annually with this cut. Rural hospitals cannot absorb that. That's going to be a significant impact. It's estimated that 10 to 15 additional hospitals will close in the next 5 years. That represents 520,000 people losing access to local hospital care, longer time for emergencies, delayed treatments for strokes, heart attacks, trauma, low labor delivery, and chronic conditions. Right now, this impacts not just Medicaid, it impacts Medicare and people that have company-based insurance. If you don't have a local hospital, you're impacted. And the most deeply impacted counties are Washington, Martin, Northampton, Tyrrell, Hyden, Bladen, and Robinson, red counties. People 7 to 10, sit down, you're dead. SNAP drives $2.8 million in North Carolina's economy every year. These threats threaten 313,000 in federal support for local and nonprofits. So Chatham County's COBRA program is not going to get funded. SNAP supports 9,200 retailers across North Carolina. This benefits local groceries and local farmers. When they close, you're into food deserts. Right? Person 15, sit down, you're dead. Disaster aid and FEMA cuts. FEMA is rolling back its 100% share to 90%. It's estimated North Carolina, just for Helene, just for debris cleanup and emergency response, that's a $200 million hit to North Carolina. Delays in debris removal will impact people trapped in unsafe homes, exposure to contaminated water, waiting longer for ambulances, etc. It's estimated that 20 to 50% increase in disaster-related deaths. Person 16, sit down, you're dead.
They don't care about us.
Infrastructure and grant cuts. This diverts a significant portion of the 2021 bipartisan infrastructure law. Remember that law? It was meant to focus on bridges, roads, broadband, public transit, and climate resilience infrastructure. This bill sends that money to border and defense projects, including building the border wall. It impacts transit grants. So the New Bern Avenue, the Chapel Hill NSR PRT will be impacted. 44% of HUD's overall budget is slashed. This impacts rental assistance, public housing, homeless support, and senior disability housing. North Carolina receives $30 billion annually in federal funding. By having that cut, it's going to impact transportation, education, health, housing, and agriculture here in North Carolina. North Carolina has 550 people living in FEMA designated flood zones. Those flood zones haven't been updated in decades, so that number is much higher than that. It's about 600,000 people rely on small rural water systems that are going to experience degraded water quality and outages. It's estimated that 250 North Carolinians rely on rural transit each year. That is also gone. People 17 to 22, sit down, you're dead.
They don't care about us.
Budget shortfalls. So you know the legislature's not done squat about the budget this year, right? That budget only covers 2/3 of North Carolina's budget. We are a taker state. That means we take more money from the federal government than we send. That accounts to 30% of our budget. And that has been slashed. And just as an example, the North Carolina Department of Health and Human Services is going to lose $23.9 billion, or 70%. K through 12 education, that's 17% of funds, $3.1 billion comes from the federal government. Safety net programs are going to be slowed and shuttered. Person 23, sit down, you're dead. Environmental impacts. This bill cuts 40% from the EPA funding. It's lowest level since 1990s. Funds for clean water, wastewater will drop by close to $300 million. This cuts make it more likely the industry will dump pollutants with less oversight, raising risk of unsafe air and drinking water. They're going to roll back clean energy and climate protections. Funding from the Department of Energy's clean energy R&D, including solar, wind, battery storage, and grid modification, has been slashed by 40%. Fish and Wildlife Service budget cuts by 25%. Writers undermine the Endangered Species Act. This budget halts EPA's ability to enforce environmental justice initiatives, tackling inequality in polluted and underserved areas. Clean water rules for mercury emission standards, methane reductions, and lead paint enforcement are restricted or blocked. Air pollution rises, contributing to asthma and cardiovascular disease. Clean water access is threatened. Increased flooding, heat waves, and storms due to unchecked climate change. The low-income, elderly, Black, Latino, and rural communities are disproportionately harmed. Person 24, sit down, you're dead. Attack on STEM. National Science Foundation has been cut by 55%. National Institute of Health has been cut by 40%. NASA has been cut by 52%. NOAA has been cut by 26%. CDC has been cut by 44%. Those grants fund Duke University, UNC Chapel Hill, NC State, and the Research Triangle initiatives. It's estimated that 25,000 people are going to lose their jobs statewide with these cuts, and impact $5 billion in downstream economic activity. Why does this matter? Slower progress on vaccines, cancer drugs, and diagnostics. U.S. risks losing innovative edge. Lost federal money means fewer tax revenues and tougher economic recovery on North Carolina, and social equality. Person number 25, sit down, you're dead.
RFK resign.
Increases in ICE enforcement support. It broadens ICE's ability to detain and deport undocumented immigrants, apparently also documented and U.S. citizens. It allocates over $100 billion to ICE through 2029. $45 billion for constructing new immigration detention centers, gulags, 46% for border wall operations and related infrastructure, $14 billion for deportation activities and enforcement, $10 billion for hiring and compensating 10,000 new ICE agents. Persons 26 to 34, leave the square and you're disappeared. 26 to 34, leave the square, you're disappeared. That's 34 North Carolinians. That represents 34% of us. That's 3.74 million North Carolinians that will either directly or indirectly die or be disappeared as a result of these cuts. Persons 35 to 95, sit down and turn around. You think this bill does no harm to you because it does. When 34% of us are hurt or gone, you will feel it. 34% may be your grandparents, your parents, your siblings, your children. It may be people that planted, grew, picked your vegetables. It may have built your homes, cleaned your cars, served you in hospitality. The water you're drinking contains unsafe PFAS because there's no one to regulate how much PFAS was in it. You and your family are suffering from asthma because ozone is back from lack of regulation and burning more fossil fuel. Research that helps you survive cancer diagnosis is gone, and life-saving medicines weren't developed to save you. And how long do you think it will be before polio returns in North Carolina and impacts your child? Are you persons 96 to 100? You represent the 5% wealthiest in North Carolina. These top positions help you the most. You'll be impacted, but you won't care because you have the funds to overcome it. Look, everybody, this was a choice. This was a choice. And even Senator Tom Tillis realized this was a bad choice. But he was the only Republican in North Carolina that voted against this bill. The only one. Remember this in 2026 and 2028. Remember how this was done. Because many of these programs don't kick in until after the 2026 election. Again, most of these actions don't kick in until after the 2026 midterms. That was done on purpose to hide what they're doing from you. Remember this. Remember this.